here with us. She is an ER nurse and super passionate about helping new nurses find their new thing. Sarah, I'm so thankful that you joined us.
Oh, I'm so glad to be here. Thank you for having me here today.
Yeah. So I always like to do an icebreaker to allow people to come in and just get a feel for who you are. Tell us your funny nursing story.
After working 10 years in the emergency department, I feel like I've seen and done it all. But I think my favorite one was not one that happened to me, but that I actually saw someone else. So we had a gentleman come in with a rectal foreign body that was a sex toy. And he had to have it extracted, which happens more often than I'd like to count. And at the end of the day, are you still there, love? Looks like, well, maybe you are. So at the end of his stay, he wound up getting discharged. He was very ready to get out of there that day. Hear me, darling? Okay, sorry. Things keep moving around. Hi, guys. Hi, so good to have you here. Sorry, this is my first time on Be Live. So I'm telling the story of a gentleman who came in middle-aged with his sex toy up his bottom, and it got stuck, and we had to get it out. Now, we did all the things that we needed to do to get it out that day. And at the end of the day, he was getting discharged. He was very in a big rush to get out. But we are also very passionate and want to ensure that you leave with everything you come in. So if we cut off your clothes, we'll give you the stuff back. If you come in with your phone, your charger, we want to make sure it's in a bag and back in your hands before you go. So my colleague, being the diligent ER nurse she was, ran out because he had left his bottom plug. And so she ran out going, sir, you left your bottom plug. We want to make sure you get it home. And he left very speedily in his car out the way. She chased him out to the parking lot. And that's just the dedication we have as ER nurses to make sure your stay is as good as it can and you can leave with all the things you came with.
Oh my goodness, that is hilarious. That is amazing.
Sorry, probably more colorful than you were hoping for, but it is my favorite.
No, that's perfect. I absolutely love it. So when did you decide that you had a passion for helping these new nurses?
So I've been an ER nurse for about 10 years. I started in Georgia in the emergency department. I went through an accelerated master's entry program. That was a clinical nurse leader program when it was just a few years old. The program had been set up as a satellite campus, and like many things in nursing education, it was just kind of fly by the seat of your pants more than you wanted to. I was in a cohort of very type A, very ambitious students. We wanted to do everything as best we could, but we were presented with a very disorganized program where we were jumping through lots of hoops. Every nursing student has these stories. Like they showed up to clinical, they switched locations. They'll the day before tell you to show up at 7 a.m. when you were supposed to be at 7 p.m. instead. You don't ever have enough sleep. You never have enough food, and there's not enough caffeine on the planet to get you through. So I graduated, got through my NCLEX, started in the ER, and everything again was total chaos all the way through. And while I started in a great community setting, learned amazing things, was really well supported where I was because I was really lucky. I didn't see that for all of my cohort in nursing school. So a lot of them went off to other programs. They may not have had the support they needed to really thrive, to get through with the mental health challenges that they were having, because nursing is so hard on us, psychosocially, emotionally. And I didn't see everyone getting the help they needed to find their job. I didn't see them. There was a big gap of resources, not enough to help new nurses get through their program, sit for that NCLEX, which is what I feel like nursing school really is focused to get you passing that exam. But then after that, it was like, and then what? No one was telling them how to apply to jobs, how to interview for jobs, how to do those resumes, which are so crucial to getting that job. And so as my career evolved, I started helping my colleagues with some of these things because I was just nerdily into it. So I was helping them with resume prep. I was helping them with get ready for their interviews and just present their best self. And over time, it just kind of developed into this like passion of mine to really see not just new nurses, but also experienced nurses get to do the new things that they wanted to do in their career. And so I started a company called New Thing Nurse. It started about 2017, so we're just a few years in now. That has really a menu of services that caters to help support nurses throughout their nursing career with their new thing, be that their new job just out of nursing school, transitioning from one specialty to another. I've helped nurses from age, I think 20 was my youngest, and my most seasoned nurse was 65, get back into the nursing field after a long time out. So I worked with everyone, and I just love helping nurses through New Thing Nurse. And New Thing Nurse has evolved. It's NEWTHING Nurse. We have a business. We have a huge social media group and followers. We're very active on Instagram and Facebook. I have a blog. We have community service projects. We do live events now. We do these wonderful things like Q&As on Facebook, and it's just grown so much over the last 3 years. And it's really just a safe space for nurses of all experience levels, from nursing school to the retirement, to come share and get support for what they need.
Awesome. That's so great. So these new grads that are just coming out of school, they're in a difficult position, kind of being baptized by pandemic. What specific suggestions do you have for those who are in this position?
Absolutely. So we are living in the weirdest year of nursing probably in the history of modern nursing. And with that, we're also in the weirdest market for nursing jobs right now.
Right.
Even though we're facing this overwhelming novel virus and all the things that are coming around that, hospitals right now are in this very strange space. So they're in either these hotbeds of the COVID crisis, like New York City, Detroit, New Orleans right now, where their ERs have been in the recent past overwhelmed with COVID patients. Their inpatient units are being staffed by travelers. They can't get enough nurses in to support the need of their patients. Mm-hmm. Other areas in the country have seen a huge decline and decrease in patients presenting to their hospital. And so in other areas of the country, we have nurses that are being furloughed, which means sometimes that they're taking time off with benefits, but no pay, sometimes with pay. Sometimes we're also seeing nurses getting laid off. Mm-hmm. We're also seeing services be proactively closed. So a lot of elective services, so like your endoscopy, GI, special procedures, all your elective OR procedures. And these are big money makers for hospitals. So what we're also seeing is hospitals facing a very difficult market right now, where they don't have a lot of money to invest in employment. So hiring nurses is very expensive. Hiring new nurses is even more expensive. It costs tens of thousands of dollars to train a new grad into a new specialty, even something that seems very general, like outpatient clinics or med surge. So right now, new nurses are facing one of the most kind of just the craziest market we've ever seen for modern nursing. And it really depends regionally on where you are and what is happening around there. But new grad spots are going to be few and far between in some areas. And you're really going to have to be able to advocate and shine in the areas where they are hiring. So what I'm saying, telling all my new grad nurse clients, is that first look in your area and see who's hiring. And don't have your blinders on for just acute care jobs for hospitals. The best thing you can do right now is be flexible and open-minded. So nursing is so big and vast in all the roles we have available to us. We are in inpatient units, outpatient units, schools. We are in public health departments. We are doing phone triage. We're doing telehealth. We're working in all kinds of environments right now, and all different acuity levels, in education, research, and so many things. And so while a lot of us are seeing and hearing this image of you are the bedside hero, the frontline staff, and we just see nurses in scrubs and all the PPE at the bedside in the hospital, that might not be where you're going to land your first job. Yeah. And no one cares where you start your career. You're going to start your career in all kinds of things. If you ask any nurse who's been working for more than 5 years, where they started and where they are now, there's usually a really wild path of where they've been. And even for someone like me, who's been in the emergency department for the last 10 years, I have done so many other things outside of the hospital on top of that. So I think if you can be open-minded, really research all the opportunities in your area, make sure you have a great application. So we want you to have the strongest paper documents for you. So that means our digital documents, which would be your resume, cover letter. And if in your area you need a new grad nurse portfolio, you need those. You need to practice for those interviews and make sure that every interview counts. And I think prepping and investing in that time to prepare all those things, getting second set of eyes, third set of eyes to look at all those things will really support you to getting a job in this market. I think every new grad nurse will be able to find some sort of job, because we're going to have this huge amount of nurses that are either tied up in areas or leaving the field because let's
Mhm.
be real, COVID's been stressful and a lot of us are going to need a big old break after all of this. But there were going to be opportunities, but just being flexible with that role that you're going for. Don't think I only want to start in the ICU. You
Mhm.
may want to, you can be in the ICU in a couple of years, but maybe we're going to start kind of somewhere else when we get started this year.
That's great points. Absolutely. So, how can these nurses start making these connections right here and right now? Maybe they're not quite graduated, they haven't taken the in class. Where do they go to make connections?
So it's never too early to make professional connections. And some of the best ways you can do it right now are from home. So I live in the Bay Area. I live in Oakland, California. We're still in shelter in place. So it's not even an option for people to go and try to meet and greet in person.
Mhm.
And really, with the infection prevention standards that are out right now, we all need to be staying home as much as possible. So a lot of people think networking is going to events and meeting people in person and dropping off resumes. And it's 2020 and that's not necessary.
Right.
Some of the best networking you can do right now is from home on your computer or phone. And what you can do is there's several avenues that I always recommend is the first and foremost being social media. First, professional social media that is recommended now is LinkedIn. If you don't have a profile, I highly recommend you getting one. I also highly recommend researching how to write a good LinkedIn profile because as if everything in the digital age, hospitals are using recruiters and also software to sort and search through LinkedIn for certain keywords for certain profiles. You can also prevent your best professional self, not maybe your social life on LinkedIn. So that's a great way to connect with people. And you can also be pretty aggressive in making connections with people over LinkedIn, more so than Facebook, because the whole point of LinkedIn is to link with professional contacts. And so sometimes people are much more open to connecting on LinkedIn than they are through Facebook or Instagram or some other forms of social media. Another place to look at is your professional nursing organizations. These are incredible places to network. So, for example, for emergency nursing, I'm part of the Emergency Nurses Association, or
Mhm.
ENA. Their website is ena.org. And on there, if you want to join as a student, which right now they're having free memberships for nursing students until the end of May. If you join for free, that's free 99, everyone can afford that. You're going to get access to a whole year of membership, which includes all the online resources that they have, which
Mhm.
includes educational resources, but more importantly for you is their online social networking kind of messaging board that they have, and also the career support services they have. They have a completely free mentorship program that I'm a part of as a mentor that you can take advantage of as a member. They also have these message boards where you can go online and post like, hi, I'll be graduating in May, June, July, whenever that is. I'm located in Kansas City, Kansas, and I would really love to know what emergency departments might be looking for new grads right now.
Mm.
This is a great way to kind of do some research, find out who's hiring, and also the people reading those messages are usually nurse leaders. So these are directors, managers, educators who are going to be doing the hiring and firing for that department. So these are great people to reach out for. Do keep in mind that you want to have very professional discourse on these message boards. You are presenting your best professional self and presenting what kind of brand of nursing you would bring to a facility. And these are also leaders who are looking to hire. So you want to make sure you're presenting your best self to your potential bosses in the future. Another organization I highly recommend is the American Association of Critical Care Nurses, which is AACN. They have many support online resources, including networking opportunities. And then there's basically a professional nursing organization for every specialty in nursing. So whatever your
Right.
interests are, you can join a professional organization for that. If you just Google labor and delivery nursing professional organization, one will pop up. And with those, almost all national professional nursing organizations have local chapters, which may be local to your city area or maybe to your state. And almost all of them have an online presence on social media, so mostly Facebook and sometimes Instagram. And with these Facebook, I know that, so the Emergency Nurses Association, our local chapter is the East Bay ENA. And we have a Facebook group that anyone can join. You don't even have to be a member. And on there, we post and have discussions and things like that. And we love it when new grads come and join us and say, hey, I'm graduating in May. I'm really interested in any opportunities that might be out there. Would anyone be willing to kind of talk to me about, walk me through what's going on in the market right now? I'm very open. And especially if you're open to moving, you can kind of join these groups at whatever location you're interested in going to. And often people will be very open with you about where a place is hiring. Maybe some facilities don't take new grads at all, and so you don't want to waste your time with those facilities. And often they'll tell you where you don't want to work, because nurses love to vocalize what maybe isn't the best idea for our career purposes. So they love complaining about places that they don't think you might want to work. So either way, very valuable information, and all this you can do from home.
That's great advice. So do you feel like a new nurse starting on the floor is different or better than that starting in a residency program or one of those sorts of opportunities?
So I feel that in this market for 2020, you really can't be picky about applying to residency programs versus individual preceptorship programs. I would say at this point in the market, I would apply to any organization that's taking new grads and be very excited for any sort of opportunity of employment there might be, especially in the acute care environment. What you would want to look at when vetting new grad opportunities. So one to keep in mind is that not all new grad residencies are created equal. A lot of really big name organizations that are brand name research teaching facilities have new grad opportunities, and they may not be the most supportive environment. So I've had people go off to some really big name facilities, come back to me and say, I had a terrible it wasn't a good fit. It was just not where I needed to be. And so they've transferred to smaller facilities maybe and done really well because they've gotten a lot more one-on-one attention and support. I started in a community setting facility. There was not a new grad residency per se, but I did get about 10 to 12 weeks of preceptorship. I got a lot of education. In addition to that, I was just very lucky to do that. And we did have several new grads, so we kind of made a little mini residency in our own way, but it was by no means like advertised as a residency or anything like that. I think the things that really make or break it is the support of your educator, the opportunities they give you for continuing education, making sure they get you into all the certifications you need, pay for those certifications if possible. In certain markets, that's not common, but in most parts of the U.S., that is. And then also making sure you get at least 12 weeks of preceptorship and making sure your preceptor is a good fit for you. Some preceptors get assigned just because they're a body with a pulse that's available.
They're voluntold.
Yes. They're like, hey, you're going to precept this new grad. That might not be the best fit for someone, you know. Sometimes, and depending on the individual new grad nurse, sometimes a variety of preceptors are great, and sometimes that one dedicated preceptor is the best fit. Also knowing that sometimes the job you get may not be the dream job you wanted, but also being open-minded and accepting and looking for other opportunities down the road that might be there. But I truly feel that residencies are great when they have all the components that make a great residency, but it's not always the end all be all. And I really encourage people to be open, and also don't be afraid to call hospitals and see if they're hiring new grads or even willing to take a new grad, because sometimes a department might be willing to take one new grad, but they're not really thinking about posting it. But if they find the right person, they might be willing to invest.
Okay. Good. So Francine wants to know, before COVID, a huge part of interview was being able to tour the unit and meet the nurse managers in person. Now they're not allowing unit tours and in-person interviews. I've interviewed for a few and had tour units didn't have tour units due to COVID. I experienced virtual tours through FaceTime as well, and no virtual tour at all. Any advice for these sorts of interviews?
So I think right now a really great way to find out kind of how a facility is really trying to do that online networking and trying to find people who work there that are at the bedside and not necessarily in leadership. A bedside nurse who's very open, will give you a much better idea of what it's like to work there, what resources are there, what is it like right now with COVID. You have to keep in mind a lot of these leaders are stretched thin to the max. They have an impossible situation right now. They're balancing budgets. A lot of them have been at work every single day for weeks on end on some level. They aren't sleeping enough. They're on 24/7 because we're facing a public health crisis, a national emergency, a global pandemic. It's not their ability to communicate effectively for new grads in new grad interviews may not be the best right now. So I think tapping into those other resources are really good. Presenting your best self online is really important. So making sure that for those Zoom and FaceTime interviews, which are challenging, to make sure that you're professionally dressed, you're looking good, your hair is okay, everything's pulled back, a nice face of makeup, some good lighting, and a neutral background. And whatever you're wearing, not to be too distracting. So you can make sure you're making eye contact with your camera. You may want to practice that if you haven't done that a lot, because if you look like I'm looking at my keyboard now, it's like I'm not making eye contact with the interviewer. So making sure that you look dynamic and engaging on the screen, but also not too distracting. So you don't want to overdo it with the hair, the makeup, or anything like that. And you don't want your background to be like your pile of dirty laundry. You don't want it to be your door with your mom or your family or your roommates coming in and out. You don't want your dog barking. People make decisions on employment and hiring very quickly, often in the first couple of questions. And if you show up looking a mess, like you just rolled out of bed, or showing a mess behind you, they may not be very excited to hire you. And also every opportunity really is, you got to make it count right now. In regards to the tours, a hospital's a hospital oftentimes. And I really think that you shouldn't judge too much about the actual facility at this time, because it's not what it looks like normally anyways, because we are in the pandemic. I think really reaching out online and trying to find people that work at the bedside in those departments at that facility would give you the best picture of what the facility's like as an employment place.
Great. So Kelsey wants to know any advice in general or COVID specific for a new grad starting in the ED. She is not in a residency program.
Okay, she's not in a new grad residency program. And tell me the rest of the question one more time. Sorry, you broke up a little bit.
Oh, sorry. Any advice in general or COVID specific for a new grad in the ER?
Oh, yes. Could go on and on. One, join the Emergency Nurses Association. It'll be the best thing you ever did. Join now before the end of the month, because it's free. Two, you definitely want to keep an open mind, because every day is going to be different. It's going to be stressful. It's the hardest thing you'll ever do, but it's the hard that makes it great. I love that quote. I think it's from Lily Up There. Anyways, I really feel that you have to just take it a day at a time, a shift at a time, find a mentor or someone who you can debrief with regularly. That can be someone, maybe it's your preceptor, maybe it's someone on shift, maybe it's multiple people, but also finding your tribe online, like if the tribe are in, is amazing. Also, ENA, your local ENA chapters will be a really great point of resource. The Emergency Nurses Association, again, has just given me so much. They have that mentorship program actually through ENA, and I think that could be a really great opportunity. You just need a lot of support. You need your people around you. You need to ask lots of questions, because you're going to see something different every single day. And working right now, especially surrounding the time of COVID, being safe is a key piece. So making sure you have the personal protective equipment that you're supposed to have, that is the appropriate level for the patients you're seeing, because these are unscreened from the community patients, and COVID is everywhere now. Making sure your isolation precautions are appropriate, and advocating for your needs and staying safe. There's this really great phrase that I feel like is my mantra of 2020 is there's no emergency in a disaster. So there's always time. Never rush into a room, never rush anywhere. Always be very cognizant of what you're getting into, and make sure you have that N95, your eye gear, your gown, your face shield, whatever you need, because patients are untested and unvetted. We don't know what we're walking into every day. So make sure you take care of you so you can take care of others.
Great advice. So Kim loved the ER, med surg, and OR, but disliked the monotony of the clinics. And this was during her clinical rotations. Where do you recommend that they start, since there's not a lot of acute care positions available?
Yeah, so that's a hard one, and it depends on your area and your market. So in the Bay Area, for example, every year is a very difficult year for a new grad to get into a acute care facility. There's very few programs in comparison to how many new grad schools, nursing schools there are in the area. So we're producing lots and lots of nursing students and new grad nurses, and there aren't just not enough new grad positions. So for like example, if you're a new grad in the Bay Area, if you really want acute care, I would suggest looking out of the area or even out of state. Versus some places in the Midwest, for example, like I have colleagues in South Dakota. They say they almost always have space for new grads in the the inpatient units. And so in these areas, you might find more opportunities. But again, keep in mind, all facilities are facing difficult markets. They have very tight budgets this year. So I would not turn down any opportunity, but don't necessarily apply to things that you know you're going to hate. If you know that it's not something you want to do, it might be better to just wait it out until there's more opportunities in the future. Nursing's never going away. There will always be opportunities in the future, but it kind of comes down to, do you need a job now? Like, do you need to pay bills? What are your needs? And what's available in your area, or are you able to move away where there might be more opportunity?
Yeah, absolutely. So as a new nurse, Kim feels like she knows nothing. Don't worry, Kim, you're not alone. We all felt like that. And she wants to know, is there any way you can feel more comfortable without looking like an idiot?
I would say no, and I don't think that ever ends. So I started my first job outside of emergency room this year. I'm in outpatient radiology for the first time at a pediatric facility, and we see inpatient and outpatient patients coming in, but predominantly oncology patients and also pediatrics. So I have always worked in the ER. I know many things. I can put an IV in almost anything. I can run your telemetry. I can run your code. I can do all these things, but it's the ER way. It's a little messy. We do what we need to do to get it done. Nothing's very organized, nicely labeled. Everything's in a knot. You might have seen the meme with the Christmas lights, ER versus ICU. We've all seen it. I love memes. I am the ER meme. So I started out this radiology department, and I'm working directly with anesthesiologists and CRNAs, and they are very organized, very labeled, very neat. A drop of blood under your tegaderm is a problem on your IV. So I'm there knowing 10 years of nursing, right? Like thousands of IVs in, and literally I'm relearning how to put in an IV right now because there's new equipment. I can't leave anything dirty. You know what I mean? Like, I'm so getting reschooled in things I've done possibly a million times. Just because it's a new style, it's a new department, people have new requirements, the charting's different, everything's different. And so I'm that new kid who feels dumb, knows dumb, but I also am being really kind to myself because now 10 years in, I know that you can never know it all. You might get comfortable in one arena, but as soon as you jump into something new, you're going to be uncomfortable. But with that discomfort comes growth. Yeah. And growth and confidence over time. And so I'm just thrilled to be learning something new, working with a pediatric patient population, which I love. And, so you might not ever feel completely confident in what you're doing, but you'll be more comfortable with that lack of comfort in the future.
Sure.
And just know we're all like that. And if anyone ever makes you feel dumb or bad for asking questions or making mistakes, they're not being the supportive person you need right then. They're probably doing a great job. They're doing the best of what they can. Everyone's doing the best they can right now. Everyone's stretched to the max and so stressed out. But never, ever feel bad for making a mistake. You learn from your mistakes and you grow through discomfort. So I hope that's a good answer for you.
Yeah, and there's no stupid question ever. No. Even if you asked it 10 times, ask it again to somebody different. They're going to have a different perspective, and perhaps this time it's really going to sink in for you.
Yes, it's nursing, healthcare in general is often, there's no right way to do it. There's a textbook way, and then there's all the other ways, which you may see. There's 1,000 ways to put in an IV and put on the tegaderm and tape it up. There's 1,000 ways to put in an NG tube. There's 1,000 ways to chart an assessment. Sure. So, I mean, you're just going to have to do what you do. There's foundational pieces that are so important and to remember, and you know those. I'm sure you know a lot of those in nursing school. And if you don't, you're going to learn them. Mm-hmm. And often you don't know what you don't know until you don't know it, and until someone tells you. So you're going to learn so much as a new grad, and just, I think, being patient and kind with yourself and asking all those questions and allowing yourself to fail and not feeling guilt about failing is the key piece. And that comes with time more than anything.
Sure. Agreed. So these new nurses that get clinic jobs and they don't get in the acute care setting where they really, really want to be, how do we, as clinic workers, keep up with our skills and our knowledge, and how do we keep up on that stuff when they feel like they're going to lose their knowledge or lose their skills?
Sure. Those are great questions. So there's a lot of different ways. One, you can take didactic courses. A lot of them are online right now. There is a wealth of opportunity to educate yourself right now on so many topics because people are putting out so much free content. And that, I think some of the best content can be gotten through those professional organizations. So if you invest, even if it's about $100 a year in your professional organization membership, you are going to get access to so much free content with your membership online through their websites and through their communities. Another option is to, as the pandemic moves forward, there will be an opportunity to get face-to-face time with patients again. So volunteering is often a great thing to do. When I was in nursing school, I volunteered, I think, at 2 free clinics and became a volunteer coordinator at one. And at our free clinic, it was a primary care clinic that did some procedural stuff, but I was a nursing student with like no certifications in Georgia, and I got to draw blood, do assessments, do triage, dispense medications with a pharmacist over me. I mean, I got to do all the things. And that was because it was a nonprofit. They had protocols, and they needed just, all they required was a nurse to be in school, to be a volunteer there. Other opportunities, if you don't have nonprofits in your area, is to look at like California has a California Health Service Corps, I think is what it's called, where they're taking volunteers right now to go help and do assessments and triage, a lot of it related to COVID out in communities. So these are often more rural communities that don't have as much healthcare and public health access as many of the more metro areas. And so you might be going out door to door with the appropriate protective equipment, checking and screening people to see how they are, if they have symptoms, how they are. You also might be doing a lot of telephone or telemedicine right now, volunteer work. And then there's a lot of organizations where you may have to start in a non-clinical area, and then you can work your way into a clinical area. Sometimes that can be American Heart Association, assisting with like blood drives and things like that. Sometimes they're doing blood pressure screenings, but basically as soon as you get an RN license, you can do all the things that as long as you know how to do it and there's an organization willing to let you do it, they will let you help practice within a certain scope. And so I think seeking out those nonprofit opportunities, those volunteer opportunities can be a really great way to kind of get clinical time while you're not working officially. And then if they do open up opportunities again in the future, job shadowing is a great way to do it. Volunteering in a hospital is a great way. But those are kind of in a non-pandemic year avenue. So everything's new right now. We're all working through this, but those clinical skills can definitely be utilized even when you're not officially employed as an acute care nurse per se.
Great wisdom. So Kelsey asked, a lot of us missed out on things like senior practicum this semester and thus feel less prepared entering the workforce. Do you have any specific pearls of wisdom, encouragement, or advice for us? And likewise, I'd like to kind of piggyback on that question. How do they discuss their lack of practicum on that resume that they need to prepare?
Great. That's a great question. So one, for all of those areas where most of those practicum opportunities were shut down at the same time, take comfort in knowing that almost all nursing schools in those areas will have students graduating without a practicum experience. So you're not alone. A lot of the local nursing schools here do spring senior practicums in the Oakland area, and they were all canceled or abbreviated. Maybe they got like 3 weeks into 10 weeks or something like that, 6 weeks, whatever it is. So what we're doing is one community college is actually issuing a letter that the students requested saying that they intended to have a 300-hour senior practicum, but it was abbreviated or shortened because of the infection prevention requirements of the facility. So know that they were offered 300 hours, but were only able to fulfill this much. It's not the fault of the student or the fault of the school. It's just what happened. Sure. Other things, and you can include that with your application oftentimes when you get to the interview. If you're in an area where people did get to kind of complete a senior practicum, but you may have been part of a program that couldn't, then spinning that on your resume is going to be really important. So I always, if you have a shortened practicum, always make a note of it somehow on your resume. I usually start in the Bay Area, you have to have a whole section of all your clinical rotations for all the new grad positions. Each clinical rotation, so you need the name, the facility, and the number of hours for every rotation, and then a total number. And usually you put your senior practicum kind of at the top of that section with a couple bullet points kind of describing what the unit was like, how many patients you were taking care of, any special opportunities of education or training you might have gotten. Under that section on that bullet point, we've been putting on all my clients is a bullet point that says if they were fulfilled 100 hours of 300. We put 100 of 300 in the hour kind of column. And then underneath there's a bullet point that says practicum was shortened because of COVID infection prevention requirements, or shortened because of the COVID-19 pandemic, something along those lines. So that then gets kind of noted on your document. In addition, you might want to put something in your cover letter is a great opportunity. The cover letter document's a great opportunity to address anything that's kind of unusual about your resume. So, for example, if you had big gaps in your education, if you have any sort of criminal background thing that you need to explain. Some people have a DUI at age 20, go to nursing school at 40, and they need that to explain why they have like a limited license for a period of time until they earn the full license back, but they can work in certain arenas. Anyways, lots of things that you may have to explain on the cover letter. So that's a good point. But also I would recommend saying that just don't focus on your senior practicum as much. The senior practicum is 300 hours of your nursing training. In long run, it's not going to be the make or break thing for you, especially if you're not applying to a job on that unit. When it's really important kind of is if you're applying to a job on that unit, that had been an opportunity for them to kind of train you, and then you'll get an extended training with your new grad position in preceptorship. And so they'll kind of know what you already know, and they've also kind of done an informal probationary period with you already. If you're applying somewhere completely different, in a different state, different city, different facility, different unit, if your senior practicum was in like L&D and you're applying to ICU, it doesn't really matter. Like, people don't care that much. If you're a good, coachable, flexible, smart, critical thinking applicant, they can teach you everything you need to know. What they basically want to know is that 1, you completed nursing school, 2, that you passed the NCLEX, and 3, that you're not completely insane or a pathological liar or have no ethics or whatever of those things. The resume basically gets you the interview. The interview confirms what they like on paper and to make sure that you'll be a good fit for their team.
That's perfect. So once you get that interview and you have the opportunity to ask some questions, what are some really good things that we as nurses need to be looking for? And is there any red flags that you just need to walk away?
So in an average year, this would be a little different. But again, this is a pandemic year. People's personalities, especially over digital video conferencing avenues, are not going to be really easy to read, 1, and 2, might not be how they normally are. A lot of us are in the healthcare field are very shell-shocked right now. A lot of us are very depressed. We're going through major trauma. Our friends and family might be sick or hospitalized or passed away. Things are crazy right now. Okay, so first I want you to just take everything you experience and see online on these video conferences with a big grain of salt. Next, I would say that red flags would be if, for example, an interviewer is overly eager to get you on the floor. So if they are like, when can you start? How much training time do you need? Are you an independent thinker? Do you like to just go in and work? Those would all be red flags, because you're a new grad nurse and really you need some time to be trained. And again, every situation is different. So if you've worked for 4 years on a floor as a unit clerk and you're applying to a new grad job, you may need a little less time to transition than a new grad who's graduating in California, moving to Georgia and starting a new grad job. I think another red flag would be if they are rude to you or potential, and again, this is all you have to take it with a grain of salt because this year is so hard on leaders and they're having such a hard time. But if they're overly rude, if they're overly personal, if what they're questioning, like if they're like, how many kids do you have? If they're asking things they're not supposed to ask, there are certain things that people can't legally inquire about in an interview, and you should definitely look that up. And most of them are related to what's your sexual orientation, what's your age, are you pregnant or not if you're a female, if you plan to have kids in the future, like all those things they can't ask about. But if they try to allude to those things, sometimes I feel that's very inappropriate. And if they're inappropriate in the interview, they're going to be hecka inappropriate probably on the job front. So even if this is your only opportunity, if you're ever uncomfortable with their line of questioning, if you feel that they're going to put you in danger, if they're not paying you enough, there's one thing to be making a little less than maybe on the market rate, but if they're not paying you enough to pay your bills or offer you the appropriate package for compensation, those are all big red flags for me personally. And so I would say that you would want to maybe consider trying to, and that also could not be exactly the situation, but trying to find people that work there and maybe double checking or confirming those details. Or if you get the job offer, maybe take the job offer, talk to HR, and see if everything that they're presenting is factual or not. Because also sometimes things just get spun in a funny way in the interviews.
Sure.
So I think those would be the major red flags for me.
Sure. So if a hospital has magnet status, what are the pros for shooting for position there versus non-magnet?
So magnet status means that a hospital has gone through a very rigorous application process through the national organization that issues the magnet status and has applied for this very hard to get designation as a magnet facility. And what magnet means is that it's a very nurse focused and nurse supportive organization in addition to offering exceptional patient care. Magnet requires that an employer or facility offer a lot of support services and resources to their nurses. So it really hones in on making sure that nurses can continue their education to at least a 4-year BSN degree. They offer a lot of, they have a certain percentage of certified nurses in their areas of specialty. So for emergency nursing, it's the Certified Emergency Nurse Exam, CEN. If critical care, it'd be like the CCRN, things like that. They also usually have some form of shared governance, which is like unit-based councils. And they have a real opportunity for nurses to progress beyond just task monkeys at the bedside. So if you're applying for a magnet facility position, that's kind of lovely. But again, not everything is in a name. So some places have been magnet that I've worked with clients at, I've worked at myself. And I have found that for whatever reason, maybe it wasn't a good fit or it wasn't as supportive as the magnet designation may imply. So always just know that it's not everything's in a name, but magnet is a great thing to have when you're looking at facilities. And it usually means there's a lot of support for their nursing staff.
Absolutely. So Elena scored her first job. Good job, Elena. She starts June 8th, and she is wondering if you have any last minute tips. And she's also a little bit nervous. She's only taking care of up to 4 patients, and their max on her application, or sorry, on her job description is 6.
And do you know what kind of setting it is?
She didn't mention. Hopefully she'll chime in.
Okay. Sure.
Yeah.
So congratulations on your job. That's fabulous. And last minute tips. So 1, just try to take care of yourself and enjoy your time off between now and nursing. You'll have the whole rest of your life to work at the bedside. So taking your time off, I wouldn't overly worry about prepping anything. Just making sure you have all your P's and Q's kind of done. So make sure like your HR stuff's done. Make sure you have your scrubs you need that are the right color. Get your stethoscope out and dust it off and put it to the side. Maybe get your bag prepped with your lunchbox and stuff. But otherwise, don't stress too much about overly prepping. I think you can't prep too much for your first weeks. You just have to sit and do it. Yeah. Orthopedics, great. Okay, so that's a fast-paced environment. You're going to see a lot of turnover of your patients. So I think focusing on being flexible, asking lots of questions, because there will be a lot of procedural stuff that you'll be learning. It's very cookbook in a lot of ways. So you're going to like not be familiar with stuff for a while, but you're going to learn stuff and see a lot of the same things over and over again. If you haven't taken care of 6 patients before, you'll learn. And also, census is really low right now. So you might not be getting 6 patients at a time up front, because a lot of units are not super full right now. Often with your preceptorships, they will work you up to 6. They will not start you with 6. They will start you with 1, 2, 3, 4, that kind of thing. And just enjoy this time, because this is the last free time you'll have as kind of before you start your nursing career. And so I think that time's really special. Take time for you, check out some Netflix, eat the food you like, talk to your friends and family, and try to stay in touch with your cohort, because they're about to all spread off into the 4 corners of the world. And it's nice to keep in touch with them, because you'll definitely kind of grow apart over time.
Absolutely. So Kevin wants to know, how important is fit when you're looking for a new organization?
Fit as in like for the applicant and the FIT?
I would assume yes, fit as in
Great.
FIT,
Okay.
yes.
Sorry, these video conferencing.
I know it's challenging for sure. It's true.
Okay, so fit. So I feel that some things are just going to be a great fit and some things are going to be a terrible fit. Nursing's hard in general. Being a new grad is going to be hard. Like, don't expect anything to be easy about it. It's just going to be difficult. If you have a good day, celebrate it, enjoy it, embrace it, but don't expect it to be like that the next day, because every day is different. There's so much change. You're going through such a transition of identity. Also, you're going from nursing student to new grad nurse. You're going to be responsible for people without being able to say I'm just a student anymore in the near future. You'll be like, I'm new here, and that'll last for a while. I still rock that sometimes. I'm like, I'm new here, and people are like, you've been here 7 years. Stop that. So I mean, I think fit is just kind of, things are gonna be hard. It's not gonna feel great probably at first. So give it time, I think, is key. And then sometimes if you're 6 months in and you're really unhappy, sometimes even sooner, 3 months in, that might not be a good fit for you. And I think if you're sad, if you're anxious, if that's happening every single day, it's one thing to be a little uncomfortable, like maybe I don't know exactly what I'm doing, I need to ask some questions. But if you're feeling that unsafe, for sure, if you're feeling disrespected, unsupported, sad all the time, anxious all the time, fearful of going to work, and these are things that happen sometimes.
Sure.
I would definitely do a self-assessment and see if this is the best fit for you long term. You may want to start, 3 or 6 months from now, we don't know what the market's going to be like. There could be completely different opportunities. And if you're at a larger facility, often there are opportunities to transfer out of your department. So if you start in one and you're like, I hate this, I'm not going to be able to do this. Oh my God, what am I doing? And you're like 3 months in, sometimes you can transfer out after 3 months or 6 months. So it's never too early to look at other opportunities, to start networking with other departments at where you're working. It's so much easier to get a job at a facility you already work than as an external candidate. So there's internal and external candidates. So much easier to transfer once you're in, because you have some seniority, people, they will make space for you, and you're not so new that you need as much training.
Agreed.
So I think keep an open mind, give it a few months. It takes time to see if you're going to like it or not. If it's something that's identifiable, like your preceptor is just not a good fit for you, advocate maybe for a new one. Those little things sometimes can make a huge difference. I was on nights for a long time, like all new grads are. I was not doing well. I was very unwell for a long time. And then I got on days and things were so much better. And that was just what I needed to make that change. Sometimes even changing weekend shifts can be different if you have a set team and maybe the team isn't a good fit for you. So sometimes little changes can be made to improve a situation. But if you ever get to a point where you're not doing well, like you're unwell and it's a toxic work environment, unsafe, or any of those things, never be afraid to make a change.
Agreed. And something to add to, if you have an area where your unit floats, and you can add yourself to a different area to float to. So maybe you have an interest in, I don't know, the infusion clinic. If your specific area can float to the infusion center, put yourself on that float pool list. And that gives you a little in when you have the opportunity and you've kind of had a foot in the door and you got to take a look at it and get paid while you were doing it. So there's so many opportunities. I agree with you. And something I liked what you said when you said sometimes in 3 months or sometimes in 6 months. But I would
sometimes
right. And a lot of people, you hear a lot of people say, give it a year. You have to give it a year. And, if you know, then you know, and you need to step away. This is not worth your life and being miserable for a year. Like, that's not why you worked your butt off in nursing school. So get out there and seek out other opportunities. Don't stop learning where you're at, but definitely, don't sit there miserable just because they say, give it a year.
And culture has changed in nursing and healthcare in general. Is the generation that's coming into the workforce now is not a workforce that stays at a facility for 40 years and retires
Right.
at the same facility they start at. Culturally, it's much more acceptable now in healthcare to jump around specialties, jump around jobs every couple of years. Some people even more a couple months. There's opportunities if you love change and thrive, like making transitions from one place to another. Travel nursing is a great opportunity once you have a few years in. There's opportunities to there's so many opportunities for growth. There is a type of nursing for every personality. I met one nurse who got to a point in her career, she was like, I hated talking to people. I was ready to leave. And then she transferred to OR. And y'all, she only worked intubated, sedated, not talking to her patients. Like, it was perfect. I'm telling you, there is a place for everyone in nursing.
Yes.
So don't give up. That's the main thing. Like, keep an open mind and keep looking for new opportunities if you feel that you're in a place where it's not a good fit for you.
I agree. So many people reach out and they're like, I'm just burnt out. I'm just done.
Oh.
I'm like, but there are so many opportunities in nursing. What are you burnt out with? Like, what specifically has got you at your wit's end? Because if we can talk about that, then we can talk about maybe we can look here. Maybe you should look at these opportunities. So I agree. There's so many opportunities in nursing. It's like the best career ever.
Yeah,
so,
it's the greatest thing I ever chose to do, for sure.
For sure. So Courtney has another question. Those of you who are tuning in live, get your questions in before we wrap up with Sarah. So she says, during an interview, how much of your personal life should you talk about? Like, I'm really interested in peds, and I've had practice with my daughter when it comes to tracheostomies, changing PIVs, machines, and cough assist ventilators. Is that something I could tell them if they ask, and why should they consider me or not?
So I think personal questions, you always want to keep it job specific. So the interview is to talk about why you want to work there and why you would be a great candidate for them and a great addition to their team. So if your personal life is pertinent to the job that you have applied for, so the role that they are interviewing for, not a role in another department that you're interested in, not what you want to do in 6 years if it's to leave that department. You applied to a pediatric ICU job. They want to know why you would be a great pediatric ICU nurse. So if you have a child with like complex medical needs and you have years and years of experience working with her, that is absolutely important information to include. However, you want to include it at the right time, and you want to make sure that you have ample stories and experiences to draw from in the clinical setting that does not have to do with just your daughter. It's kind of like the same reason you don't want family members to write your letter of reference. If you only have reference points that are with your family in your own home and not at a clinical environment, that they want to hear what you did in an actual hospital or a clinic or whatever environment is very comparable to whatever environment it is you're being interviewed for. I think information that is not important to the line of questioning. What are your plans in the future? If your plans are to buy a house in the mountains, move 5 hours away and have 12 kids and then 25 dogs, that's a great dream, but you don't need to tell your future boss that. All you want to do is sell yourself as a competent, professional, great brand of nurse who's there to be a dedicated member of their work team. If they try to ask you questions that take you away from the job that you're interviewing for, just reframe your answer back to that, because sometimes that does come up. They may do probing questions along the lines of, tell me about your family and what's going on there, or things like that. Tell me about yourself. Maybe they're hoping to learn kind of about your family life. Just bring it back to them. Be like, I'm really passionate about helping the underserved, and I'm really excited to be working at the opportunity to work at your facility because I know you have a great commitment to working with the underserved in our community. Just bring it back to the hospital, the facility, the clinic, whatever you're applying for. Your home life really doesn't have much to do with your nursing role generally. Now, in these exceptional cases, that may be something different. The questions that I think is okay to talk a little bit about your personal life are things like, why did you become a nurse? If you had an experience where you took care of a family member or watched a family member go through a long course of treatment, or you yourself was a patient for a long time, that's a great opportunity to share those stories.
Absolutely.
And then if questions like, tell me how you manage stress, maybe you can incorporate it there. So things like, I love to talk to my family. They're my support team. And so they help me really kind of like blow off steam at the end of the day and things like that. Those are okay. But generally, you just need to talk about your clinical experiences, your professional healthcare experiences, and keep it to that kind of topic because that's what they're most interested in.
And the flip side to that, as someone that was part of the interview committee for many years,
Yes.
If you talked to me about your child who is trached and vented and those kinds of things, I might wonder how often, like what kind of family support do you have to make sure that you're going to be reliable
100%.
and so from an interviewee's point of view, make sure that you're not sharing too much, like, well, yeah, we were in the hospital for 2 weeks last year. To as an interviewer, I'm kind of like, oh gosh, well, what are we going to do without her for those 2 weeks? So just, I'm not saying don't share. Please do when it's applicable, like Sarah said, but just keep those things in mind that if your child is hospitalized, you know, you're going to be out of work, which is good. She needs you. Don't even think that you need to not be there. But as an employer, that's going to cross their mind. So lots of questions coming in, Sarah. Are you good for this?
Great. Yeah, I'm here. Let's do it.
Okay.
Charge my battery. We're
good. Okay. So what's the best way to approach asking how the facility you're applying to is handling COVID pandemic and how they're supporting their nurses during this time?
So those are great questions. So generally, you don't ask a lot of questions to the employer or the interviewer until the end of the interview. Generally, they're asking all the line of questions. And then at the very end, they go, do you have any questions for us?
Mm-hmm.
And I think that's a really great question. It's very timely, topical. Tell me about what's going on right now at your facility related to COVID-19 and how are you supporting your staff right now? That's a great time to ask those questions. However, the questions when they give you the opportunity to ask questions at the end, do you have any questions for us?
Mm-hmm.
You don't want to ask any probing questions. You don't want to ask really any potentially controversial questions. You want to end on a really good note. You could have an amazing interview, and then at the very end, if you ask something that could be perceived as offensive to someone, you may have just blown your opportunity for a job offer. So I think a great question would be something along the lines of, COVID has been so challenging for our community. Can you tell me a little bit about what you're seeing at the hospital right now? COVID, I know, has been so stressful for you and everyone at Frontline and Healthcare. Can you tell me kind of how your staff and you are feeling right now? I think those are good general ideas, but you don't want to be super specific. How much PTO would I get if I broke my leg next week? Like that kind of stuff. Like they may be like, why is she asking that? Don't ever ask a question where the response could be, why did you ask that? Because the market is usually so competitive in a lot of areas that they have their pick of who they want to offer jobs to. And so it can be these little things that make or break your opportunities. So I think asking kind of just neutral questions. And then what I always recommend that clients ask at the end of the interview is, thank you so much for having me here today. What are the next steps in the job offer process? When should I be hearing back from you? Because that's a great way to get you to have some peace of mind. One, because some of the HRs are stretched really thin right now because they're not usually very staffed, but also they may have a lot of applications, a lot of job offers to process right now. Schedules are changing all the time with hiring freezes and openings and things like that. So things might take longer. So last year, it might have taken 5 days to get back to you. Now it might take 3 weeks. And so you want to know kind of like when to stress out. I haven't heard from them in 4 days. Is that time to stress or not to stress? And then some facilities have very long turnaround time. So like the VA, for example. They can take weeks to months sometimes to make a job offer. And that's just because it's the government. And right now, especially the federal government is stretched very thin. And so they're not committing as much time maybe to their HR. Maybe they're committing more resources to other things. So you may be looking at 4 weeks, 6 weeks or longer turnaround time. Most people that thinks that's really long. And so you'd probably be stressing out, and you don't want to be stressing out to the point where you're getting in touch with them too early, bugging them for a response or anything. So I think that's a good question to ask. And the other thing I always recommend to ask is, can I get your contact information? I'd love to follow up with you later. And what you're looking for is an email of just anyone on the hiring panel, the people who interviewed you. So all you need is like one point of contact. If you can get more than one, that's great. And what I recommend doing is 24 hours to 48 hours after the interview to send a thank you note to the interview, email, the interviewer's email, and also to attach your resume again in a PDF format to that interview, that email, so that they again have your document in front of you and you're back in their mind. So if they're maybe debating who to offer things to, you have come back in their face and maybe they're like, it's a sign, I should hire them. So you never know why people hire other people, but you want to give yourself every opportunity for exposure as possible in a very positive professional manner.
Absolutely, I agree. So a few more questions have come in. When is a good time to start applying for new grad positions, such as the residency program? She's graduating in September.
So residency programs often have a time frame where they're open. They're usually only open for a certain period of time. It's dependent on facility, though. There are some facilities that have rolling residency programs, so they may have 3 or 4 cohorts in a year. Often facilities that are medium to smaller size only have 1 cohort a year if they have a residency program. And often they'll have information on their website about when they'll be doing hiring. And then it depends on the state too. In very competitive markets, a lot of places don't want you to apply unless you've passed NCLEX. Okay. And so you need to graduate, you need to pass NCLEX before you apply. Some facilities will take your application without your NCLEX pass-fail for consideration. And so in those facilities, they'll generally say on their job requirements or eligibility requirements, and they often will have the timing of when those applications will be accepted.
Okay.
And then some facilities do it early, like a couple months early, and some of them do in a short time frame, very close to when they want to interview, process, and hire. So I would say anywhere you're interested in applying, to start looking. If you graduate in September, now is a great time to kind of do some research about when they might be doing hiring. If that information isn't on the website, to start maybe trying to seek out people on LinkedIn or Facebook, who through groups kind of like Tribe RN, to kind of see who might be working at those facilities. And then if they can give you some insight into what happened last year, and just know that it'll probably be a little different this year because we are in the time of COVID-19.
Sure. And do you recommend those students wait until their senior practicum, or until they're getting at least their foot in the door of their senior year or their last semester, before they apply? Or again, it just depends on the recommendations of the hospital?
I think it depends on the facility and also the person. Like some people know, I knew the first day of nursing school, I wanted to be in the ER.
Okay.
I didn't need to be in an ER to confirm that. By the time I got to my preceptorship, which was in the ER, I knew I wanted to be in the ER. And I had started a conversation with the two. I lived in a small town, so there were only 2 ERs. So I had started the process of looking to apply to those ERs like the day I got into nursing school. If you're in a big metro area, maybe you don't know what specialty you like. You may want to wait till your last semester. I think waiting till your senior year is reasonable because before you start looking anyways, because you probably don't know what you like until then. But you're really not going to be a competitive candidate until you're in your last semester anyway. So the actual applications probably you don't even need to put out till the last semester. But again, depends on when you're graduating, when they're doing the hiring at those facilities. Some are seasonal. You may graduate in May, you may graduate in July, you may graduate in December, and facilities are hiring at a certain time. So you may want to put in your application early, depending on what that timing is. And again, everything's different this year. If there's an opportunity and you're in a place where you qualify to apply, I recommend applying, because some places are doing 1 cohort of new grads this year instead of 2 or 3. They may be doing less. They may be hiring now and then delaying the start of that program until the fall and just keeping that first round of applicants. And that's the only people they're going to be hiring this year. So it's a very unusual year. So if you see an opportunity that you think might be a good fit, I would just recommend applying to it if you qualify, and then you can kind of figure out the rest later.
And those nurses who are just adamant that they want those scarce specialties like L&D or PICU or PEDS, and that's just where they want to be, and those jobs just aren't available, what do you recommend for those nurses?
So if you have a certain patient population you really are passionate about working with and you can't get an inpatient job related to it, consider the outpatient services that care for those patient populations. So if you love pediatrics, but you can't get into an inpatient pediatric facility, start looking at pediatric doctors' offices, pediatric outpatient clinics. If you love L&D, birthing centers that are out maybe affiliated with a hospital, but sometimes standalone, but where you can go and have a non-complicated birth in a safe space called a birthing center usually is a great space. Consider public health departments and working in this. They have different programs of service. And often if you love adolescent health, you can work in a service that might support adolescent health. If reproductive health is your passion, start looking for outpatient clinics that do women's health services. It just kind of think outside the box and go, where do those people take their family for care when they're not in the hospital? Because most people don't spend that much time in the hospital, and those people are getting healthcare in some other avenue. School nurses are a great resource for whenever school opens back up in your facility. That can be a really fun one. A lot of outpatient surgery centers might hire new grads, but again, that depends on what things open back up. So whatever that specific specialty is, consider what other options are in line with that patient population. That might be your best bet right now.
And I'm just going to say, if you're in the Tri-Barian group and you really want L&D and there's just nothing like that in your area, reach out, ask, hey guys, I really want L&D and there's nothing in my area. I'm in Kansas City, Kansas. What opportunities do you know of? Network with people, because sometimes they have ideas that a lot of us have never even heard of. Our career is so far reaching, so don't hesitate to reach out.
Absolutely. And don't feel that if the opportunity is not just in your area, that you're doomed and can't get a job. Sure. And also some students I've worked with have felt pressured to run back into graduate school to continue their studies because they couldn't get the job they wanted. I would say that is also not a great option. Just getting more and more degrees isn't always the answer. I think sometimes it's being more creative with your job search, and then also networking is huge. And then consider relocating if you're able to. If you're in a position where you're able to relocate, opportunities are so different state to state, sometimes even like county to county. So, and imagine that, like, even if you're leaving, maybe you're just leaving for a year and you can do anything for a year. I've worked with clients that have found a job 6 hours away in a completely different part of the state where there's a lot more opportunity. They clustered their days together and they would rent a room up there, go work their days, and then come back home to their families the rest of the days off. If you're creative, sometimes 6 months or a year, it will pass by so fast and you will be a completely different applicant with 6 months to a year of experience than you were as a new grad.
I totally agree with that. So no more questions are coming in. So I just want to know, what are you looking forward to most in your career?
So I just started this new position I was telling you about earlier.
Yeah.
At a pediatric facility. And I've done a lot of pediatric work at my emergency department job where I still am per diem, but it was a community setting and we didn't have inpatient pediatrics. So my options for growing in that area was very limited. And this opportunity, I never thought I would work outside of the emergency department, but an opportunity came up through a colleague that I used to work with. And that's another thing I think you should always keep in mind is never burn a bridge if you can avoid it, because everyone knows everybody in nursing, especially once you get to these subspecialties like ER nurses. I know probably everyone in the ER in America through somebody, especially through Emergency Nurses Association. So I always try to put my best foot forward and never trying to like burn bridges, and always try to keep people in contact as much as I can through Facebook, LinkedIn, whatever those appropriate channels are. So a colleague I used to work with put me in touch and said that they were hiring, that they worked with a lot of pediatrics. They wanted people who could start IVs, and she was wondering if I was interested. So I jumped on it. And it was a really hard first couple of months transition because I was used to being very good at what I did at the bedside. And it has been a huge learning curve, but I have been stretched hard and been very uncomfortable and very frustrated some days, but I've gotten to a nice place now where I'm learning and not so hard on myself and really enjoying the new culture of the new facility. It's been really great. And then other things I'm really excited about. So New Thing Nurse is the company I use outside of my hospital life. New Thing Nurse is my company and my community right now. And we're working on a huge project to get personal protective equipment to frontline healthcare providers that don't have it right now. So in some areas, the PPE supply chain has been fixed and they have plenty of masks and goggles and gloves and gowns and face shields that they need. But in a lot of America, especially outside of the hospital setting, people are working with COVID patients without any protection at all, or the bare minimum. And so I'm working with volunteers from across America and donors to get funding to help purchase PPE, source it, find it, and ship it to places that need it most. We're sending hundreds of items to people across America. We've even got stuff going down to Mexico right now because there's a free clinic by someone runs in Texas that is in Matamoros, Mexico. So we're helping people there where they've set up a field hospital to work with COVID patients. These are organizations, most of these people that we're donating to are very small departments, maybe outpatient facilities that don't have access to the big vendors that are providing PPE to all the hospitals. And with the shortages, there's just not enough to go around for a lot of people. And also there's a lot of financial barriers to getting access to that stuff. So we're working on that. So we're doing a fundraiser right now, and I'll share that with you guys in TriBarN. We have a GoFundMe, and they're also selling a t-shirt that's a fundraiser t-shirt. All the proceeds go to getting PPE. So it's been really awesome to see our community come together as healthcare providers to take care of other healthcare providers and make sure that they're offering safe, supportive patient care while being safe themselves.
Absolutely. And this isn't going to be applicable to people that are watching on replay after this week, but during Nurses Week, Sarah is offering a resume overhaul as a gift. So I am so thankful that you've done that and loved on the tribe that way. And Kevin actually just said, thanks for being part of the TriBarN giveaway. So I'm super excited for our students, whoever gets chosen for the resume overhaul, or new nurses.
I'm so excited to do it and pair with one of your followers. It's going to be so fun. I love it.
It is. And your FN Essential t-shirts, those are both, two of them are being given away in the tribe as well as gifts.
I just put one in the mail today, I think, for one of your winners. So it's on its way if you're watching right now. It's on its way.
Awesome. Yeah. So it has been so great learning from you today, and such great information has been shared with us. So in closing, I want to know what your favorite new nurse hack is.
So my favorite new nurse hack, I think, is God, that's a great question. I think some of my favorite new nurse hacks are coming out right now with COVID, and some of it's being done by newer nurses because they're super innovative and haven't been doing the same thing the same way. So I've seen this online, and I heard it was a newer nurse, but I don't know if it's true. So a lot of what we're doing right now in the inpatient setting, if you haven't been there recently, is trying to get all the stuff we need to provide patient care outside of the patient room. So if we have a COVID patient who's on isolation, we want to go in that room the minimum amount of times possible to provide appropriate care to help conserve our PPE, our personal protective equipment. So some of the things I've seen that are really cool are people are taking the IV poles and all the infusion pumps and everything. They're bringing them outside the room and using extension tubing to run it into the room, like 10, 12 feet sometimes to get to the patient, so that when you're changing their drugs on your pump, you don't have to go in and out of the room during that time. Other things I've seen is that also to kind of along those lines is to hold that tubing up. They're using a stat lock that you would use for either a Foley tubing or an IV, and putting that on the wall to run all your IV tubing through so it's not on the floor. And then I've also seen the use of things like baby monitors or tablets to interface with your patients in the room, outside the room. And I think the one that the extension tubing was supposed to be a new grad who did that. The other ones, I don't know who's sourced all that, but right now is the golden age of nurse hacks with patient care. And I just love all this stuff I'm finding mostly on social media is where they're sharing it. But I've seen it on social media, and the next shift, it's in my department. It's happening that fast because other people are seeing it too. So if you have an idea, take a picture, make sure it's HIPAA compliant and doesn't have anything with patient care information in there. But take a quick picture, post it, and you may see it in the other departments before you know it.
It's awesome. Thanks for being here with us, Sarah. We appreciate it. Have a great day.
Bye. Happy nurses.